I want to start, Dr. Lipkin and Shannon, with a photo that a Korean couple took. It was a wedding photo where everyone was wearing surgical masks because of the concern over MERS. This was a bit of a joke. It was meant as such, but of course there's some underlying truth to all of this. What is the chain of events that happens if MERS does turn into something like SARS? Are we there yet, Shannon?
Well, that's probably unlikely, and Dr. Lipkin can explain a little bit more of the science behind that, and people wearing face masks around town might be a bit of an exaggeration at this point because MERS is not spread as easily as SARS. MERS, from what we know, and we don't know that much about it because it's still a relatively new virus, but it requires close contact, and most of the people who've been infected are healthcare workers or family members of those who are infected. So it's not something you're going to get on the subway, necessarily on an airplane or at a wedding party. So right now it seems like sort of the fear and anxiety is a little bit over the top compared to what the reality is in infection. But yeah, maybe Dr. Lipkin can explain a little bit more what the true risk is to people at this point.
Well, no, these viruses can change and they can become more transmissible. But at present, this virus is not as transmissible as was SARS. So I think all those masks are definitely over the top. On the other hand, the virus is transmitted through the air, and if you have very close contact with people who are infected, as has happened in hospitals and other very tight quarters, there is concern.
Now, Africa and Asia have tended to be the sources of new pathogens if you're looking at SARS or Ebola, not necessarily the Middle East. Because of that, do we have less information to work with? And as a result, is MERS a bigger unknown than previous infectious diseases that captured our attention?
I think you've raised an interesting question. We don't know a great deal about infectious diseases in the Middle East. And this is a major concern because you have mass gatherings there. You have millions of pilgrims who go to Saudi Arabia annually from all over the world.
Last October.
Exactly. And as they become ill, they return to their home countries, and they can carry infectious agents with them. I was in Saudi Arabia last week. The Saudi Arabian government takes this very seriously, and they are interested in developing a very strong surveillance program to reduce this risk for themselves as well as for the world at large.
Now, according to the World Health Organization, though, there was not a single case attributed to the pilgrimage. Does that mean that we presume transmission just isn't that easy?
It's probably going to be something that requires some sort of close contact, not sort of walking past people. But one thing that is interesting here is that as you mentioned, this is a disease that's been isolated mostly to Saudi Arabia. There's been about 400 deaths, most of those in the Middle East at this point. But it's just a reminder, as we saw in Ebola, that all of these viruses that we think are far away and overseas and don't affect us, in this global connected world, they're really a plane ride away. And that's why everyone sort of needs to be vigilant and paying attention to these and not really think that the U.S. or Korea or Europe is immune to anything that's happening in Africa and Asia. That things are so transmissible so quickly. We learned that in Ebola. We're seeing that again here. We have had a couple cases of MERS in the United States as well. It didn't really spread through, as it has in Korea, but it's sort of a cautionary sign.
Well, the feel is very different from Ebola when there was just this mass panic. The WHO has met to discuss MERS, I think, 8 times since July of 2013. Each time it has decided not to label it as a global public health emergency. Dr. Lipkin, is that a good thing when it comes to understanding the disease and educating the public?
I don't think we can, on an every other month basis, declare a global infectious disease emergency. People stop paying attention. Ebola was far more dangerous than is MERS. MERS has a case fatality rate of about 10%. Ebola was much higher. MERS is actually higher. It's actually close to 40%. SARS had a lower case fatality rate, about 10%, but it was highly infectious. So I don't have the same sort of response to MERS that I had to SARS. I was in China during SARS. It completely overwhelmed that particular community at that point, and Ebola obviously had devastating consequences in West Africa. And I think there's going to be fallout, economic and otherwise, from this in Korea and in China.
Dr. Lipkin, if the Korean government is able to quarantine people, isolate it, use proper infection control, will this just burn out on its own in South Korea?
Yes, I think this should burn out of its own accord. But as you've already said, there's the potential for this to emerge and reemerge continuously, because unlike some of these other infections we worry about, this one has an animal reservoir.
Yeah.
And it percolates up into the human population, then it goes human-human.